When it comes to health, none of us is infallible. Both doctors and patients can make mistakes. Because women have unique needs, it's really important to know common, but not always obvious, errors that might put your health in jeopardy. Women know that if they eat too much and exercise too little, it's bad for their health. But there are other, lesser-known mistakes that can put women in peril.
I thought I had a cold that wouldn't go away.
So radio host Billie Marie Morrison went to the doctor and was first diagnosed with pneumonia, then bronchitis. Both times, the diagnoses were wrong.
I'm like, congestive heart failure? Am I going to die? Am I going to die? And he's like, you should be dead.
Heart disease is one of the most common misdiagnoses in women. More women than men die of heart disease, yet only 1/3 of life-saving heart surgeries are performed on women every year.
Sometimes women have just simple symptoms like they're short of breath, they feel a little sweaty, they feel a little nauseated, and that could be a full-blown heart attack right in front of you.
Leg pain in women is also sometimes misdiagnosed.
35% of the patients that I now see are for peripheral vascular disease. These are patients that are often diagnosed with arthritis of the spine, of the knees, of the hips, where they can't walk.
A complaint of dizziness may signal something far more serious.
Their memory is getting worse, and these are some of the signs that perhaps they've been having a little mini strokes.
According to the Johns Hopkins Center for Innovation and Quality Patient Care, 98,000 hospitalized Americans die every year because of medical error. That's 268 every day, or the equivalent of a fatal jet crash. But it isn't always the doctor's fault. Patients themselves are sometimes to blame.
1 million women a year have an abnormal pap smear. 300,000 of those require treatment in order to prevent cervical cancer.
Half of all women who have an abnormal pap smear do not follow up.
For some women, it changes something that's easily treatable as an outpatient to a cancer, to something that could actually kill them.
Doctors also warn, don't quit antidepressants cold turkey.
Because antidepressants work on brain chemistry and affect the rest of the body, going off of them abruptly is not a good idea.
While many studies tout the benefits of a glass of wine with dinner, research shows that women who get drunk once a month triple the risk of heart attack.
Alcohol is more toxic to women's bodies than men's. Women, in order to benefit from alcohol, should drink no more than 1 standard drink per day.
Would you like any whipped cream or anything else?
Reaching for the cup of joe first thing in the morning doesn't just wake you up, it may ward off disease. Multiple studies indicate that people who drink coffee on a regular basis are up to 80% less likely to develop Parkinson's disease. As cold season arrives, you might want to add a little green onion to your lunchtime salad. Its white stem is rich in sulfur, which helps inhibit infection, and is also used in traditional medicine as an expectorant. For an afternoon snack, try magnesium and fiber-rich peanuts. A Harvard study found that women who ate 5 one-ounce servings of peanuts or 5 tablespoons of peanut butter a week lowered their risk of type 2 diabetes by 20%. And finally, a sweet way to end your day. Research in the Journal of the American Medical Association shows dark chocolate may be good for your heart. Bars with a cocoa content of 70% or more are linked to lower blood pressure and lower LDL cholesterol. Just beware, an ounce of dark chocolate packs 150 calories, so don't overdo it or your weight gain will outweigh the benefit of chocolate.